With a new variant on the horizon, a new study is shedding light on how Canadians were impacted by the pandemic and the position we're in to face another wave of COVID-19. A study of antibody levels across the country indicates a large majority of us are showing signs of immunity in two ways, through vaccination and through previous infections. With me now to discuss is Dr. Christopher Labos. He's an epidemiologist and cardiologist. Good morning, doctor. Good to see you.
Good to see you too.
So this study looked at hybrid immunity and how much of it Canadians have. What stood out for you? And maybe we should explain what hybrid immunity is.
Right, sure. So, you can be immune from something two different ways. You either get sick and your immune system produces antibodies against it, or you can get vaccinated and produce antibodies against the virus or the bacteria. So when people have used the term hybrid immunity, what they're implying is that people in Canada have gotten vaccinated, many people got sick, and so that combination of the two means that some people have at least some exposure to COVID-19. And what the current study that was published in the CMAJ, the Canadian Medical Association Journal, says was it was actually tracking the seroprevalence, meaning how many people in Canada had antibodies in their bloodstream over the course of the entire pandemic. And what stood out to me is that it was actually pretty low for much of the pandemic. We had under 10% seroprevalence for the first year, essentially. And the very high increase of seroprevalence, that really spiked largely because of the Omicron variant when it swept through this country. So most people who got sick during the Omicron wave. And that's where we're sort of at now, with about 76% of the population that has had some COVID infection at some point. What's also interesting is that you have a lot of people saying, prior infection is almost at 100%. It's actually not, and 76% is obviously a high number, but that does mean that about 1 in 4 Canadians never had COVID, which I think is a lot higher than many people would intuitively have thought before this report was published.
Okay, let's talk about vaccine compliance, because it seems by looking at this study that Canadians should feel proud of their efforts to get vaccinated.
Right. And I think what the other thing is that when you look at the timeline of this, our vaccine rollout, which happened, essentially just before the Omicron wave hit, it happened through most of 2021, almost just in time to be able to withstand the Omicron variant. Had we not had that good vaccine rollout, I think the Omicron wave would have been an unmitigated disaster. It was already pretty bad. It was sort of muted in its impact because so many people had been vaccinated and were spared the worst outcomes. If we had to go through the Omicron wave without the vaccines, I sort of shudder to think at what would have actually happened to our healthcare system. So we are in a relatively good place now, all things considered. Looking forward, the important thing is going to be maintaining that momentum and making sure people realize that COVID is not quite over, and that come the fall, it's going to be important for people to keep up to date with their vaccinations, not just for COVID, but also influenza and also for RSV if you're a senior over the age of 60, because that will likely be part of the autumn rollouts to give you some protection against the many respiratory viruses that are going to be circulating in the fall.
All right, then let me ask you lastly about the new version of the variant E5G. The World Health Organization has called it a variant of concern. How much protection do we have against this variant right now? How concerned about this variant should Canadians be?
Well, so it depends what you mean by the word concerned. It is an Omicron subvariant, so it is very similar to the previous strains that have been circulating. So it's probably not going to behave that differently. With respect to the vaccine rollout that's going to be happening in the fall, that's going to be an Omicron subvariant specific booster. And so the amino acids target that is being used for the vaccine is very similar between XBB and EG5. So there's very good reason to believe that there's going to be good protection with the Omicron booster. So, I don't think concern is the right word, but we have to be mindful of the fact that Omicron is still here. And it's a question of, do you want to do the bare minimum, or do you want to do as much as possible to protect yourself? And I would like to make the argument that you should do as much as possible to protect yourself, because nobody wants to spend 14 hours in a emergency room if you're sick. I think that's something that most people would probably want to avoid if possible.
Dr. Labos, thanks so much for being with us today.